Hi, and welcome to Fairview Range Focus. I'm David Hall. Today we're going to talk about cardiac rehab, and I am joined by three individuals. Tina Dussault, who is a speech therapist and the rehab services supervisor, and Becky Lang, who is a registered nurse and cardiac rehab coordinator, and Jessica Rasmussen, exercise physiologist and staff therapist. So thanks for joining me. It's going to be fun to talk about cardiac rehab. So maybe we can start and tell us a little bit about cardiac rehab and what exactly it is and what it is involved. Just help us understand what cardiac rehab is.
Sure. Cardiac rehab, which is short for cardiac rehabilitation,
Okay.
is a medically supervised program for patients that need to improve their health or emotional well-being after they suffer a heart condition. There's 3 phases of cardiac rehab. There's phase 1, phase 2, and phase 3. Phase 1 is while the patient's in the hospital. Majority of our patients experience this with an interventional cardiologist or a physician that will want a therapist to work with them while they're in the hospital, doing self-care activities, personal hygiene, able to get up and move around in the hospital room, and eventually progress them to walking in the hallway before they're discharged at home. Phase 2, cardiac rehab, is in the outpatient setting. This is after the patient gets discharged home. And in this recovery process, they go from their home to the hospital there at Fairview Range in our gym, and where our therapist will work with them in exercise sessions and educational classes to help them tackle on their new heart condition. And then phase 3, which would be either the graduation from phase 2, is our WELL program, Wellness and Exercise for Life, where patients will come in and do a maintenance or supplemental exercise to get them ready. They might not be ready to exercise at home quite yet or join a local gym. They still need that a little bit of extra coaching to achieve personal health goals to get that set for them.
Okay. Wow, sounds kind of comprehensive. I mean,
Very comprehensive.
Okay.
Yep.
Now you said a cardiac condition of some sort. Is it just a heart attack, or might there some other condition cardiac-wise that would help lead to cardiac rehab?
Yes, phase 2 cardiac rehab can include a number of diagnoses, which would be either a heart attack, perhaps open heart surgery. Maybe they didn't have a heart attack
Okay.
and had open heart surgery either by valve repair or bypass grafting. They could even have stable angina per se. Patient just lives with minor chest. Angina is the chest pains usually felt by patients either radiating down their arm, back, jaw, pains that are associated with their heart. Maybe the doctor feels like it's not quite yet to intervene via a surgery or stents, or maybe they already did have that and they still have a little bit of that angina going on. And ideally, the exercise, getting them in that exercise routine and lifestyle changes should help alleviate those angina symptoms.
Okay.
And then also heart failure could also get them into phase 2 cardiac rehab as well.
Okay. And it sounds like exercise is probably a really dumb question, but I mean, it sounds like exercise is really a big part of what cardiac rehab is about.
Yes.
What's the difference between, I mean, if just going to a gym and doing exercise, kind of on someone on their own versus cardiac rehab program that's supervised, what's the difference?
Yeah, with phase 2 cardiac rehab, when you get a patient to come into that, which first off, research shows that people that do attend a cardiac rehab phase 2 after they get out of the hospital after a heart event, those patients are more likely to reduce their readmission rates back into the hospital from the same heart event recurring in the future, because it's going to be more of a guided program. Back in the old days, my dad, when he'd go to exercise, he would just basically hit the ground running. He wouldn't do a warm-up, which is what we're going to teach our patients to do. Then the cardio, then a cool down. That way you're not focusing so much on muscle conditioning, making big muscles. It's going to be more about conditioning that heart muscle. And to do that, we have to incorporate that trained exercise session, which a lot of people don't realize they should have in their exercise routine, of having a warm-up, cardio, and then a cool down to follow. Mm-hmm. And that's just one of the small things that we cover, which is huge in the phase 2 cardiac rehab program, that they would not get if they didn't know on their own. And besides some patients, a majority, in fact, of our patients that attend cardiac rehab, they've never had any true aerobic exercise. Maybe physically active, but not getting that aerobic cardio exercise, which is what the American Heart Association is wanting patients to achieve after they have a heart event.
Okay. So it sounds like besides the exercise, education is a
Yes.
very big part of what they get from the program.
Yes, we recently revamped our program to include educational classes this year to pattern a lot of what the Fairview system offers. And these educational classes can cover a range from stress management, hypertension, learning more about the pathology of their disease, the heart anatomy, how the heart works, and usually knowledge is going to help take care of a lot of the fears that the patients will have in cardiac rehab.
And the cool thing about these educational classes is it's not just these girls doing the educational classes. They've been pulling in diabetes education, pharmacy educators, and smoking cessation educators. They've been pulling in people from all over the hospital to be able to help with these education classes so that the patients are getting a really well-rounded education.
Oh,
which is
great.
very nice.
Definitely don't get that in a gym. So is there other types of patients that fit cardiac rehab or other types of diagnoses that would be appropriate besides the ones you mentioned already?
Mainly cardiac rehab is involved primarily with people that do have heart conditions. But like I said before, you do not have to have a heart attack. It could have been an easy, a doctor had a patient, decided to do a stress test on a patient here at the hospital, and it was questionable and referred them to an interventional cardiology team, and the cardiologist feels like that person might have high risk factors, and let's go ahead and get them into cardiac rehab. So yes.
Okay. Good, thanks. That helps enlighten. I think a question people often ask, of course, is, well, so, gee, how does someone get into a program like this, or do they need a referral? Does it covered by insurance? That's an important question.
Yeah, since cardiac rehab is a medically supervised program, we do have to have a physician's referral to come into the program. And most medical insurances will cover cardiac rehab as long as it has approved diagnoses. Currently, Medicare has set a guideline of diagnoses that they have to pull from. My best recommendation is for the patient to get a hold of their doctor and their insurance company to see if their diagnosis would be approved to go into cardiac rehab.
Okay, good. Thank you. So now, I know a little bit that you've had some changes in the cardiac rehab department as far as the physical layout or even the physical location. Can someone speak to that and tell us a little bit about what do you offer? What do you have?
So we recently moved. Cardiac rehab used to be in the back of rehab services where we'd offer PT, OT, and speech. It was probably about a third the size of what we have now. We were lucky enough to be able to move to across the hall, which gives us much more space. It allows us to see more patients per class. It allows us to offer these educational classes that Becky was talking about. And just provide a better service for our patients. We were able to get more machines that can help these patients achieve their goals faster and more efficiently than what they were before in our current space. Okay. So it's been a really positive change, and we've been able to offer just so much more given the fact that we have more space.
Yeah, I bet you've gotten some good
Absolutely.
feedback from...
Patients have been absolutely thrilled with the changes, especially with the changes in the education.
Right.
It's been wonderful.
Now, it sounds like there's a number of people that are involved in the program, I mean, from the standpoint of professionals. Can you speak to that as far as like who's involved? I mean, obviously, as a nurse and exercise physiologist, is there more than that, or?
We do. We actually have a pretty dynamic team. Again, like you were saying, we do have a registered nurse. There are actually 2 of us exercise physiologists. We have our master's degree. But we're also cross-training as well. So we have a respiratory therapist who's also coming down, and she's helping us out as well.
Okay.
So we have a pretty good dynamic, and again, especially with the education classes, we are pulling so many other people from the hospital setting. So we have dietitians coming through and pharmacists coming through. So it's kind of a good, well-rounded, I'd say, education and experience for people coming through the program.
Sounds like there's a lot of things that are covered through the program, but it's all a program. It's all together. They don't have to go to different places to get that information. So that's great from a patient standpoint. Good.
Definitely.
What about, just in general, can you give us a sense for if a patient enters into the program, what might they expect? When they start the first day, if you will. Can you kind of step us through there, how that looks?
Sure. So basically when we have patients coming through, they're all going to go through the same 3 phases essentially.
Okay.
And Becky mentioned earlier, we have what's called that warm-up phase. You're transitioning that heart from a nice resting level. You want to elevate it to get a nice higher heart rate, and then you're going to bring it back down. So you have your warm-up, the cardio, which is that higher heart rate, and you're transitioning one more time from the higher state back to a lower state with the cool down. We've also implemented, which is pretty new to our program, some dynamic like stretching as well as doing some weights. So it's kind of incorporated into our program. Something new we're trying. We've gotten great feedback from everyone who's come through the program so far, and basically the changes that you will see once you start adapting further along in the program itself, you're going to have changing of increased intensity or duration on a machine. So every person who comes through is going to have a little different tailored exercise prescription, but you're still going through those same components. Again, that warm up, that cardio phase, and then again back down to that nice cool down.
Okay, and while they're doing that, they have you or others at their side to help guide them and direct them as they go.
Correct.
Absolutely. They're going to be wearing a heart monitor, and we'll be
Okay.
checking their blood pressure before they exercise, during, and after. If they're diabetics, we're going to check their blood sugars to make sure the response to exercise is appropriate, and assessing them every time they come in to see if they've had any recurrence of the symptoms that
Okay.
they had while they were in cardiac rehab.
Thanks for mentioning that, because I think that the cardiac monitoring sounds like that'd be really critical. I mean, I can imagine might be a bit nervous if you came in after a heart attack or something and starting to exercise. So you're able to monitor them as they progress.
Yes. A lot of the patients, they're very concerned. They get a little fearful, which is totally understandable after
Sure.
suffering a heart event. And they always wonder, can I do this again? And to what extent can they do their activity level as before? And it's having a heart monitor on you is that gives them that reassurance, and
yeah.
knowing that they're there being watched, and to respond. We were there to be able
Right.
to respond to emergencies is exactly what gives them that comfort level to be in the gym
Oh,
with
I bet
us.
it would. Right. So, how about benefits? I mean, I bet you've got some great examples of maybe some people who have come into the program at one level and have progressed. Can you speak to that? Give us an idea. What have you seen?
Certainly. So the biggest thing that we see, I'd say personally, my best thing I love to see when patients come through is that apprehension when they first come to us. You know, there's a lot of concern when you have a heart event and you're coming to us, you're putting your life in our hands essentially, and you see transition, a complete change once they leave the program itself. They feel more confident. They're again getting back to things they used to do. And things that we have seen that are positive changes, some people are losing 20 plus pounds during our
Absolutely.
program. Diabetes, for example, medication might be reduced because now things are more controlled with the exercise. And we're also having people being taken off of medications such as like high blood pressure and other statins to kind of keep the cholesterol in check. We're seeing these positive changes just from this exercise program, which typically is 2 to 3 days a week depending on the patient's schedule.
Wow, sounds great. 20 pounds?
Yeah, we've seen a
Or
few
more.
patients
Or more.
who have lost
Okay.
20 or more pounds.
Wow, that must
Yes.
feel pretty good.
Yes,
Good,
it's excellent.
good. I think we're all conscious of the fact that patients have a choice. They can go different places. Physicians have a choice, you know, for where they refer patients. I can tell you're very proud of your department and what you do, which is great. But what do you think sets you apart? I mean, what's different about your program, or that, you know, we would say this is the place to be?
I think the structure of our program really helps in making sure that the patient's getting the most out of their exercise class as well as getting the most out of the education. Before we made these positive changes, we were doing all of it in kind of a 1 hour session, which is kind of what other programs do. They try to squeeze the education and exercise all into kind of a 1 hour bunch. We decided that it would be better for the patient to separate the two of them so that they were getting straight exercise and then straight education.
Okay.
And they don't have to kind of try to intermix the two of them and be thinking about two different things at one time. We've invited family members to that education, which I think has been incredibly helpful. And I think too, our team, the team that we have is incredibly positive. They're wonderful with the patients and they work incredibly well with the patients. And obviously they get great results. I mean, you've heard the results that Chasica mentioned, and so I think that's what sets us apart too, is the caring nature of our team and, you know, going above and beyond for the patient and knowing that, you know, they're there to take care of you if something is going to happen.
Our therapists are really good making sure that patient knows that they're not alone through this, and we're going to be with them every step of the way.
Yeah, great. Yeah, well, that personal connection and touch, it makes all the difference. So great, thanks. Now, I want to ask about something that I know absolutely nothing about, which is right here. It's WELL program, W-E-L. Can you tell us about that?
Yeah, WELL was the phase 3 portion of cardiac
Oh,
rehab, so
okay.
it's going to be the step-down unit basically from phase 2.
Okay.
It's a wellness and exercise for life. People that have heart conditions, lung conditions, or other chronic conditions can join this program in hopes to get a better condition on their goals, personal health goals, and their health.
So that's a program that you did not necessarily post-cardiac event of some sort.
Exactly.
Okay.
This program was developed this year. It basically took place of our Phase 4 maintenance program, and we adapted the system that Fairview had called the Wellness and Exercise for Life. And this door can be opened to people that are just simply overweight, need to lose weight. It's open to people with, say, high blood pressure or high cholesterol, diabetics, cancer, people with peripheral vascular disease in their legs or have had a stroke. It's an excellent program for them.
Okay. So is that a program that requires a referral of some sort?
Yes, since it is a medically supervised program, we still require that physician's referral to come before they see
Okay.
us.
And what are the hours? When is that available?
Well, program is Monday through Friday from 7 a.m. to 9 a.m. and then for the afternoon we have Tuesdays and Thursdays from 1 to 3.
Okay. And do you have a lot of people enrolled in that?
Yes, and it continues to grow. We get people coming and asking to come join the program because of these benefits they hear they can achieve through WELL program.
Okay. Tell us about the program as from the standpoint of employee wellness. As I understand that it's also a program that's available to employees.
Correct.
Okay.
So our employee fitness class is going to be separate than the actual WELL program that's offered for our Phase 3 patients. And the employee fitness in particular, there are 2 different days that you can come through. It's on Tuesdays and Thursdays. This one you don't need an order to come in, but you still need to have like a physical prior to actually starting with us. And our goal here for this is to actually get people back into an exercise program. It kind of helps, during the work day. Like I said, we had 2 different times that we kind of offer it on Tuesdays and Thursdays. So it's a nice break in between, your chaotic, busy day already in the hospital. And it's also kind of to promote, more wellness, I guess, overall general health for everybody. So we're hoping to see that, statistically showing that we're having a decrease in people calling in sick
Sure.
and, having a better, healthy environment, I think, in the hospital.
Great. Good. And that's something that's relatively new, isn't it?
Correct.
So you're getting people enrolled slowly? Or?
Yes, we are getting people enrolled slowly. I
Good.
do have some regulars that kind of come through for the classes, but we're having people constantly kind of contacting us and trying to get in this program itself.
Okay.
And like I said, it's a great offshoot of basically the other programs we have started this year, and we're hoping it continues to grow.
Good. Sounds really fun. What about pulmonary rehab? Now, and that's something I've heard a lot about over the years. There's cardiac rehab, but there's also pulmonary rehab. Is that something different? Are you looking at that? Or?
It is a different program, so that would be for patients who have lung conditions, COPD, asthma. That is actually one of our goals for 2016 is we are actually in the process of creating that plan and hope to start the program by mid-January of 2016. So at the latest.
Okay. And will that be you said that was a completely separate program.
It is.
But does it
Similar,
utilize this?
similar space, similar ideas in
Okay.
terms of having the exercise classes and the education classes. It will be set up very similar to our cardiac rehab program, just geared towards patients who have those lung conditions.
Okay. And that's a completely billed separately. I mean, from a standpoint of referrals and billing, it's a separate program. And, okay.
Yep.
But
It
I'm
has
supposed
different
it's
requirements.
Okay.
We still would need a doctor's referral in order to have that patient join the program, but it has different requirements in terms of what we need to be doing as staff and what that physician needs to be doing with the patient.
Great. Well, unfortunately, we're about out of time, but it's been really fun to talk about cardiac rehab and hear about pulmonary rehab, and really just the awesome professionals that are working in there taking care of our patients. So that's great. Thanks for what you're doing, and no doubt it's making a real difference. So, and I know you're excited about your new space and the new equipment and everything, and certainly I've heard that as well. So. One of those programs I'm sure that none of us really want to have cardiac rehab, but it's great to know that if it is something that we need as a patient, that it's available. So thanks.
Thank you.
It's fun to talk about it. So that's our show for this month. Thanks for watching. Hopefully you found it educational and learned a few things. My thanks to Tina and Becky and Jessica. Thanks for joining me. It was fun to talk to you both. All 3 of you. And so please watch next month for another segment of Fairview Range Focus. Thanks for watching, and we wish you happy holidays. So now we can talk, and because he kind of turns the volume off.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.